Pregnancy Wonders 3D, an educational channel about reproductive health and pregnancy. Subscribe to explore medicine with us and write in the comments what else you'd like to learn.
If you or someone you know has struggled with getting pregnant naturally, you have probably heard about IVF, but what exactly is IVF? And how does this remarkable medical procedure work? IVF stands for in vitro fertilization, which literally means fertilization in glass. It is a type of assisted reproductive technology, where an egg and sperm are combined outside the body in a laboratory dish. Once fertilization occurs and embryos develop, they are transferred back into the uterus. Today, we will take you through the complete IVF process using detailed, three-dimensional animations, so you can understand exactly what happens at each step. Over 8 million babies worldwide have been born through IVF since the first successful procedure in 1978. The IVF process begins with ovarian stimulation. Normally, a woman's ovaries release one mature egg each month, but for IVF, doctors need multiple eggs to increase the chances of success. The patient receives hormone injections for about 10 to 14 days. These medications contain follicle-stimulating hormone, which stimulates the ovaries to produce multiple eggs simultaneously. During this phase, the patient visits the clinic regularly for blood tests and ultrasound monitoring. Doctors track the growth of follicles, which are small sacs containing the developing eggs. When the follicles reach the right size, typically 18 to 20 millimeters, the patient receives a trigger shot to finalize egg maturation. Approximately 36 hours after the trigger shot, the egg retrieval procedure takes place. This is a minor surgical procedure performed under sedation, using transvaginal ultrasound guidance. The doctor inserts a thin needle through the vaginal wall to reach the ovaries. The needle is connected to a suction device that gently removes the fluid from each follicle, along with the egg it contains. This process typically takes 20 to 30 minutes. The retrieved eggs are immediately taken to the laboratory, where embryologists examine them under a microscope to determine their maturity and quality. On average, 10 to 15 eggs are retrieved, though this number varies depending on the individual patient. On the same day as egg retrieval, the male partner provides a sperm sample, or previously frozen sperm is thawed. The sperm undergoes a washing process to separate the healthiest, most motile sperm from the seminal fluid. There are two methods of fertilization. In conventional IVF, -150,000 to 100,000 sperm are placed with each egg in a culture dish. The sperm naturally penetrate the egg for fertilization. In cases where sperm quality is poor, doctors use a technique called ICSI, or intracytoplasmic sperm injection. A single sperm is directly injected into each mature egg using a microscopic needle. The fertilized eggs, now called embryos, are placed in an incubator that mimics the conditions inside the fallopian tubes, with controlled temperature, humidity, and carbon dioxide levels. Over the next 3 to 6 days, embryologists monitor the developing embryos closely. On day 1 after fertilization, they check for signs of successful fertilization, looking for tetranuclei that indicate the egg and sperm have properly combined. By day 2 or 3, healthy embryos should have divided into 4 to 8 cells. The embryologist evaluates each embryo's appearance, rating them based on cell number, symmetry, and fragmentation. Some embryos are cultured until day 5 or 6. When they reach the blastocyst stage, blastocysts have a higher implantation rate because they have developed further and are closer to the natural timing of implantation in a normal pregnancy cycle. The embryo transfer is typically performed 3 to 6 days after egg retrieval. This is a simple procedure that does not require anesthesia. The patient lies on an examination table, similar to a routine gynecological exam. The doctor uses a thin, flexible catheter to transfer one or two selected embryos through the cervix into the uterus. Ultrasound guidance ensures precise placement of the embryos in the optimal location within the uterine cavity. The procedure takes only a few minutes, and patients can usually return to normal activities the same day. Any remaining high-quality embryos can be frozen for future use. IVF success rates vary based on several factors, including the woman's age, the cause of infertility, and the clinic's expertise. In the United States, the average live birth rate per IVF cycle is approximately 36% for women under 35, decreasing with age. About 2 weeks after embryo transfer, a blood test measures hormone levels to determine if pregnancy has occurred. If successful, regular prenatal care begins, just like any other pregnancy. The entire IVF process, from initial consultation to pregnancy test, typically takes 6 to 8 weeks. While IVF can be emotionally and physically demanding, it has helped millions of couples achieve their dream of parenthood. Understanding the IVF process can help reduce anxiety and prepare you for what to expect if you decide to pursue fertility treatment. Remember that every person's journey is unique, and success rates continue to improve as technology advances. If you found this explanation helpful, please subscribe for more detailed three-dimensional animations explaining pregnancy and fertility topics. Leave a comment below if you have questions about any part of the IVF process.